All right, let's go ahead and get started. So, hello and welcome to the Lupus Foundation of America's first Lupus and You National Webinar of 2026. And Happy New Year to you. And I'm very excited to introduce tonight's topic. And our topic is Be Your Strongest Voice. So, we know that navigating medical care can be overwhelming, especially if you don't feel heard or you don't feel understood. So during this webinar, we're going to talk about how you can clearly communicate with your medical team, how you can advocate for your care, and navigate those difficult situations where you don't feel heard. My name is Ashley Holden, if you've never seen me on any of these webinars before, and I will be your host or the moderator for this webinar. And our Lupus and You agendas are always packed full, and this program tonight is no exception. We have four expert speakers, and I am so excited to hear their presentations and introduce them throughout the evening. And a little tidbit about our presenters is they're all experts in their field, but they all also have lupus. So they're bringing that lived experience to tonight's information. We'll start the program with Dr. Ariana Gonzalez Melendez, a rheumatologist, followed by Brian Ung, a pharmacist, and then we'll have Joy McNeil, a licensed clinical mental health counselor, followed by Raquel Dozier, a retired social worker. And like I said, I'm so excited to hear their presentations. And following their presentations, we'll have them rejoin us together to talk about their personal experiences on this topic. And we'll close out the evening with a question and answer session. So a few housekeeping items before we begin. As I mentioned, a portion of tonight's program is dedicated to Q&A. So if you have a general question for our speakers, you can submit it at any time through that Q&A feature in Zoom. So there should be a little button on your screen. Usually mine's at the bottom of my screen. And so you can submit that anytime through that feature. And then you should also have the option to submit a question anonymously if you would prefer that your name not be mentioned in that question. We will try to answer as many questions as time allows. If your question is not answered, or if you have a question that's more specific to you individually, you can reach out to our health education specialists and we'll share their information a little later this evening. Throughout the program, we'll have some polls. Please participate and help us and our speakers get to know you and your knowledge about this topic. And then as a reminder, the content shared for this program is for educational and informational purposes only. We always recommend that you consult with your healthcare team for medical advice before making any changes to your lifestyle or treatment plan. And finally, as a reminder, this program is being recorded, and you'll receive the link of the recording along with helpful resources and a post-event survey where you can submit your feedback about tonight's program. You can always rewatch this program or our other previous programs on our website, lupus.org. It's also on our YouTube page. So look out for the follow-up email and the resources. That email should come out to you on Friday. So before we kick off, I just want to take a moment of gratitude for those of you that joined us. We know that people living with lupus truly represent the heart and soul of our organization. You're the center of everything we do. Your experiences remind us every day of the urgency of what we do here at the LFA and keep pushing us forward. You know, we understand that lupus affects more than just your physical health. It can bring emotional challenges and day-to-day struggles. So we see that, we get that, and we want you to feel heard for those with those struggles. And because of you, we're driven to work harder and faster to bring lupus resources to you so that everyone can have the opportunity to help to live a better quality of life with their lupus. And if you're not familiar with our organization at the Lupus Foundation of America, our vision is a life free from lupus, and we are deeply committed to people living with lupus. We understand how challenging it is, as I mentioned, how difficult it can be to navigate the disease day to day. And for nearly 50 years, we've worked to improve the quality of life for people for everyone affected by lupus by providing comprehensive programs, resources and support for those within the community. We remain committed to doing everything we can to help you navigate those complexities, those challenges of lupus while rallying every possible resource we can to ultimately, hopefully, end this disease. And because of advances in research, care, and advocacy, people with lupus are living longer, healthier lives than ever before. And, I'm proud to say that the Lupus Foundation of America has really played a meaningful role in that progress. All right, so we have our first poll for the evening. Give that a second to get that to pop up. Bear with us. Okay, so the first poll question is, how confident do you feel speaking up during medical appointments? And the options are very confident, somewhat confident, not very confident, not confident at all, I stay quiet, or it depends on the provider. And we'll take about 30 seconds to answer that. It looks like the responses are slowing down. We'll take another couple of seconds here. All right, let's go ahead and take a look at those results. So 45% say very confident, 35% say somewhat confident, 6% not very confident, and 12% it depends on the provider. So we have a pretty big mix there. Thanks for sharing that with us. All right, next slide. So I'm very excited to introduce our first speaker. And our first speaker is going to be Dr. Ariana Gonzalez Melendez. And she completed her doctorate in medicine at Ponce Health Sciences University in Puerto Rico. She is double board certified in internal medicine and rheumatology. She also completed a master's degree in public health and a postdoctoral master of science in clinical and translational research at the University of Puerto Rico Medical Science Campus. She currently works at Demas Hospital within the Division of Medicine in Ponce, Puerto Rico, providing inpatient and outpatient services at the clinics of rheumatology. Her research interests focus on systemic lupus erythematosus, rheumatoid arthritis, and Sjogren's syndrome, particularly within the unique context of Hispanic Puerto Rican population. Alongside her academic and clinical commitments as a lupus patient and rheumatologist, Dr. Gonzalez Melendez is driven by her commitment to advocate for those navigating through the challenges of this disease. Thank you so much for being here, and we will go ahead and turn it over to you.
Hi, everybody. Good evening. I'm very happy to be here sharing some tips with you on how to partner for the better care with your healthcare system. As mentioned, I am a rheumatologist and also I am a lupus patient. I was diagnosed at the age of 15 years. So I've been living a long time with this disease. So we're going to go and start. Let me see if there you go. Okay. I believe from my presentation, this is uh, the slide that I want you to remember. Building a strong patient-doctor partnership or relationship is very important. You or we as patients are the experts on how this condition affects our daily life. As a doctor, we are experts on diagnosing and treating the condition. So the best care happens when both perspectives are valued and are aligned. And I want you to remember this through all the presentation, because I think this is the most important part. This is just an illustration of some keys for you to have a good patient-doctor relationship. Open communication is very important. You should be asking questions. Every question is important. Trust and honesty, you'll build up with time. One appointment is not enough to build that relationship, but with time, you're going to feel more comfortable, and you should feel more comfortable with your provider. Mutual respect, share decision. As I stated in the beginning, you are the expert on how you live with lupus every day. So you should be part of that decision when it comes to treatment and other themes regarding your condition. Preparing for your appointment is very important. We may have 30, 40 with log an hour with each patient. So you should go prepared to that appointment to make the best out of it in terms of time and what you want to get out of that appointment. So I try to tell my patients to track the symptoms. It's like you're writing the book of your life. It's storytelling. So you should be writing down your symptoms. If you started a medication, try to write down the date, the exact date where you started it. And if you think you're developing side effects or you have a concern with that medication, and you, for example, you develop a rash, maybe 3 days after starting, you should be tracking that symptoms. So in that appointment, it's easier for us as a physician to, decide whether that medication is not the best for you. At the same time, bring a list of medications, any changes. I always tell my patients, try to write everything down. It makes my life as a physician easier, and I have more time to answer any question or concern that you may have. uh, Questions. Research states that physicians, we give a lot of information, right? So patients remember the first 5 minutes of 30 minutes I was talking with them. So it's normal that you're going to have a lot of doubts when you go back home. So try to sit, take half an hour, read from places like Foundation, Mayo Clinic, and write those questions down. Um, in each appointment, we may not have the time to go over 20, 30, even 50 questions that you may have, but you can prioritize them. And we could, as a physician, every appointment, I could go through 3, 4, 5 questions and have the time with you as a patient to answer all those concerns that you may have. Important for us as a physician is what we call guidelines. Um, Guidelines are expert recommendations, research, and patient outcomes. Oh, sorry. Uh, I think the presentation. Oh, there you go. Um, Guidelines help doctors choose safer and more effective treatment, and they support the decision making we're going to have with you as a patient. The goals, this is very important, this slide, these are the new Lupus 2025 guidelines. And one of the most important things about these guidelines is what we as physicians are trying to achieve with patients. This table basically defines what we are targeting with the condition. And I'm just going to read remission and mild disease activity. Remission is defined as symptoms and signs of disease activity that are significantly reduced or absent for an extended time. And mild disease activity is defined as active disease that is not immediately organ or life-threatening and or causes no more than mild symptoms due to active inflammation. And these new guidelines that were on the American College of Physicians for the 2025, that is our target as physicians with lupus patients. And it's important that you have this in mind when you're talking with physicians or with your rheumatologist, so we can share the decision on what immunosuppressive or treatment is better for you. I think I'm having some, and I'm sorry for that, some problem with the presentation going through the slides. There you go. Okay. This is a very short summary of the most important things of these guidelines. The significance of 3 points that I'm going to state. Standard therapy should be with Plaquenil or hydroxychloroquine. Every patient should be using this medication unless contraindicated. The other important thing is that we're trying and we want to discontinue steroids or glucocorticoid as soon as possible. The new guidelines state to use it to control inflammation in acute episodes or in flares, but we should be, as physicians, we should be tapering that steroids as soon as possible because of the uh, chronic problems or toxicities we have with this medication. And the other very important point from these guidelines are the early introduction of immunosuppressive therapies for the same thing to control inflammation, reduce steroids toxicities, and reduce morbidity and mortality of our lupus patients. These guidelines, or as a patient, you should be aware of these guidelines. And the important is for you to feel comfortable to talk with your rheumatologist about what options are better for you. Something that's very important for me as a patient and as a physician is that the patient has the confidence and feels, he can talk to me about everything. Because, for example, the third point, sharing your personal goals, is very important. Because as a physician, I need to know, for example, if you want to become pregnant, because that's going to change the medication I can offer to you while you go through that process. So it's very important that you feel confident to talk to your physician about every aspect of your life, because this is a condition you're going to live with, or we are going to live it with for the rest of our life. So it's important for me as a physician to know what are your priorities. You can use these guidelines to ask something as simple as, what do the guidelines suggest for someone like me? Remember, every lupus patient is different. So even though guidelines help us to make decisions, every patient is different. And I, as a physician, have to tailor medication depending on your side effects and how you tolerate that treatment. Something very important that I try to do with my patient is to review labs for them to know what to look in a CBC, in a chemistry. Because if you have an appointment and you had labs drawn 4 weeks before and you understand a little bit, you're going to be aware if there's something different. And that can help you as a patient and me as a physician, because you can call for an earlier appointment if you understand something about your labs and you think you're having a flare, or you could be having a flare up of the condition. Then you can call and have an earlier appointment, and that's like preventing having a worst outcome. How to talk about sensitive topics. As mentioned earlier, it's very important for you to feel comfortable to talk about, and we're going to have, we're going to talk more about this with the other presenters. But as you may know, mental health, anxiety, and depression are very common in lupus patients, and it affects how you're going to take your medication, how compliant you're going to be with your medication. So it's very important, again, that you trust your healthcare providers and that you feel you can talk about all of these topics, whether it's pain, whether it's the side effects of your medication, and particularly how you are feeling in your daily um, lives and what you go through every day. Common communication breakdowns, not mentioning symptoms because you think they are minor. I think everything in a lupus patient is important. Not everything is because of lupus, but you should ask your doctor if you're concerned about any new symptom. Feeling rushed and not asking questions, assuming your doctor knows how you feel day to day. Remember, sometimes we see a lot of patients, and we are human beings also, so we get tired too. But you should never assume that your doctor knows that you're feeling bad. that your medication gives you a stomach ache, you need to tell the doctor so we can know. Asking tough questions is okay. It's reasonable to ask about other treatment options. That's why I presented the guidelines, so you get a little bit of knowledge on what you should be using in terms of treatment and for you to discuss with your rheumatologist. Second opinions are part of good medical care. So don't feel bad if you think you're not having a good rapport with your team, with your actual team. Opinions are valid. Shared decision, as I mentioned earlier, leads to better outcomes. When the relationship isn't working and you feel unheard or dismissed, your concerns are consistently not addressed, and you don't understand your treatment plan, speak up and ask for clarification. Remember, again, you're the expert on how lupus is affecting your daily life. Request longer visits or written plans. Seek a second opinion if needed. Key takeaways. Guidelines support safer, more effective lupus care. Preparation and communication empower patients. You deserve to be an active partner in your care. And going back to the first slide, remember you're the specialist in how lupus affects your daily life, and I'm the specialist on how to treat it. But we have to make a decision based on how you live in terms of your work, your family, the hours you spend in your work. So it's very important that you feel comfortable talking to your rheumatologist and the team. And these are the new guidelines. You can find them in the American College of Physicians, and it's free. You can download them, and feel free to take them to your rheumatologist and to sit down with your physician and discuss them. If you have any concerns or you think you're taking some medication that could be changed, maybe you're still taking steroids and reading these guidelines, you're concerned, when is my doctor going to change or going to decrease the dosage of steroids? And those are questions that you as a patient should be asking. I think, thank you for your time.
Thank you so much. That was such a great presentation. We're going to stop sharing slides for just a second. I know you were having some trouble. Want to make sure that we don't have any other tech issues as we move forward, but I absolutely love what you said. I see all of the reactions just popping up on the screen. So I think that everybody definitely appreciated the information you shared. And I'm not going to say it as eloquently as you did, but I really liked what you said about you're the specialist in treating, but the person with lupus is specialist in their day-to-day life, and really having to work together. Such important information. So again, thank you so much. Give us a brief second and we can hopefully get those slides back up so we can move forward with minimal technology. You have to love technology. It's great when it works, but when it gives you issues, it's always at probably the most inconvenient time. All right, looks like we can get them back up in a second here. Okay, so we're going to try something a little different. If you've ever attended our Lupus and Use before, you know that typically I do a lot of, or whoever is presenting does a lot of talking in the beginning. So we're going to try to sprinkle some of our programs and resources in throughout the evening. So I mentioned earlier, if you have any questions that aren't answered, especially if you submitted questions during registration, we might be reaching out to you as well with some responses. But in the background, we have our health education specialists. And like I said, you can reach out to them if you have questions not answered tonight. They are trained to support people living with lupus as well as their families and caregivers. They provide non-medical counseling, disease education, and can help connect you or any other healthcare professionals to helpful, trustworthy resources. And again, they can help answer questions about lupus, provide clarification about any information you've heard at any point, help point you in the right direction for other resources, and provide some guidance on coping with the disease as well. Some of you attending may have already spoken with one of our health educators. And again, they're available whether you're newly diagnosed, you've had lupus for 20 years. They are such a valuable resource. And if you don't need them, at least keep it in your back pocket as a recommendation. If you talk to somebody else that has lupus or is newly diagnosed, it might be a great resource for them. You can contact them by visiting our website, lupus.org/health educator. You can give them a call. The number's on the screen. You can use the QR code where you can find all that information as well. I think we have our next poll question. So let's go ahead and get that pulled up. Give us a second. Okay, the next poll question is, have you ever left a medical appointment feeling dismissed or unheard? And the options are yes, often, yes, sometimes, rarely, never, or not sure. And again, we'll give about 45 seconds to get all of our responses in. I see the answers coming in very quickly here. All right. Take another 10 or so seconds. It looks like the responses are slowing down. Okay, so the response is 20% say yes often, 44% say yes sometimes, 27% say rarely, and 9% say never. I want to be in that kind of below the with the rarely and never people. That's phenomenal. But hopefully we can do a better job in getting those concerns heard and not feeling that way after tonight's webinar. So we also have our next speaker now. And so I'm proud to introduce our second speaker this evening, Brian Ung. And so Brian Ung is a healthcare professional, pharmaceutical industry expert, and a proud lupus warrior dedicated to empowering people living with autoimmune diseases to navigate their health journey with confidence. Inspired by his early work in pharmacy, as a high school student, Brian pursued his Doctor of Pharmacy, a PharmD degree from the University of Maryland, Baltimore, gaining years of direct experience working with patients in pharmacy settings throughout his education. This hands-on background motivated him to specialize in health economics and outcomes research within the pharmaceutical industry. This unique progression allows him to help patients at a population level and gives him a 360-degree perspective on medication access, therapeutic outcomes, and real-world patient challenges. His commitment to patient advocacy stems directly from his personal experience. He has faced autoimmune diseases since age 20 and was diagnosed with lupus and lupus nephritis several years ago. Brian is driven by deep empathy and determination to actively bridge gaps in understanding between the healthcare system and patient experience. Outside of his work and advocacy, you can find Brian cheering on his Lakers or enjoying quality time with his wife and their rescue dog. Thank you so much for being here, Brian. Go ahead and turn it over to you.
Great. Yeah. Hello, everybody. And thanks, Ashley, for that introduction. So, as Ashley mentioned, I'm wearing a couple different hats today. Both one is a pharmacist, but also as a lupus warrior who takes over 12 pills a day to manage their medication, has seen several different specialists, rheumatologists, nephrologists to manage my care. And with my presentation, my goal is to give everybody some clear and actionable steps so we can start feeling a little bit less overwhelmed as we talk to our doctors and we can start feeling more confident. And it might be a little bit cheesy, but I like to kind of think of myself as the CEO of my healthcare. Even though our pharmacists and our doctors are our partners, at the end of the day, we are still the decision makers for how we treat our health. And so I hope we can build that confidence today throughout the presentation. Great. Awesome. So my first slide here, and I think Dr. Gonzalez and Melendez has also stated this, but I feel it's really important for us to prepare to manage our health and prepare for our appointments. So the first is creating a master medication list. And I say master medications slash supplements. A lot of us also take supplements, maybe into alternative medicines. And, these are a great piece of the puzzle to help us manage our medication, but it's important that we share this information with our pharmacists, with our doctors, not just the medications that they prescribe, but also those, again, that we take over the counter. It could be things such as aspirin. But all of these are important because our pharmacists and our doctors are only as good as the information that we can provide. I'll also include in this list which doctors are writing or prescribing these medications and if you have any allergies. I think writing things down, whether, you like paper and pen or you like to do things, virtually, I think that's super important. A lot of us struggle with brain fog. And so I think by writing things down, not only are we able to show this when we go to the appointment, but also to enlist the help of family and caregivers. I know myself personally, when I go on trips, with friends or family members, I do share links to my medical history or my medications because, if something goes wrong, they can then simply share the link with a healthcare professional and we can kind of reduce that brain fog that we might have. Also, in terms of managing our medications, I think pill boxes are great, something I use. Also phone reminders, not just to take your medication, but often to refill it. I know the beginning of the year is an often tough time to refill medications and all of that, but I think these are things that are much better managed when you have a routine. There's a lot of fancy apps out there if you want to get really technical, but I think developing your own routine is super important. And then I also think in terms of preparing for your to pick up a medication or to for your appointment, I think it's super important to write down questions. I know when I'm in an appointment and the doctor's showing me my labs and my head's all over the place, then I may forget, what questions I had coming into it. So I feel that writing things down allows me or someone, a caregiver that's with me in the appointment to help me take notes and answer these questions. So again, I think this also goes for when you're going to the pharmacy to pick up a medication. Now I want to talk about partnering with your pharmacist. So, as a pharmacist, I know sometimes, we can feel like super busy and, it feels like we're just, don't have time to talk to medications, but I really want to encourage you to make that space because I think pharmacists can be such a crucial member to your healthcare team. So the first thing I want to say is to really empower your pharmacists with information. Whether you go to like a CVS or your local community pharmacy, or like me, maybe you get some medications via the mail or specialty. These pharmacists may not have access to your full medication. If they're only filling one of your medications and you get another one from a different pharmacy, they're not often talking to each other, unfortunately. So that's where, again, I feel like sharing your medication list across all the different pharmacies are going to be super important so you can give that pharmacist the most information, that they can then analyze and kind of look at all the medications that you're on. Next, again, I know pharmacists can really seem really busy and they may not have questions or have time for your questions at the moment you're there. But I think it's really fair for you to ask them, can I schedule a call at a certain time when you're less busy, or can I come back later? Because again, medications, are a great tool for us as people living with lupus, but they are scary. It comes with some side effects. We want to know how these work, and so I think creating that space is something, as a pharmacist, I always enjoyed when I had the chance to talk to patients. And so I think asking for the time, even if it's not immediately, maybe you can call back later. And as Dr. Gonzalez Melendez had stated, building that relationship with your doctor is similar to your pharmacist in that it's going to take a little bit over time. And you want to continue to tell them, hey, I'm on this medication, I stopped this one, or I was feeling this side effect. So continue to check on things over time. The next is, again, you want to make sure that the medications are setting you up for your success in your lifestyle. So some key things to ask about when starting any medication is, are there any food interactions or should I eat this in an empty stomach? Are there interactions with alcohol? Is this going to make me drowsy? Can I drive after this? Right? We also, life is crazy. We've all missed doses. And so what do you do about that? Those are important questions to ask your pharmacist. Also, we talk a lot about side effects. It's also important to ask your pharmacist or your doctor is what's the frequency of these side effects? When these drugs were studied, how often did this happen? Is it 1%? Is it 10%? And also, how severe are these side effects? Did these people in the study have to go to the hospital, or did they have to take some other medication? And what should you do when you go to the side effects? Should you go to the pharmacy? Should you go to the emergency room? It's always good to kind of plan ahead, so you're not having to kind of think about all of these things in the moment when you're experiencing them. And again, that's where I want to go back to writing your questions ahead of time. Because again, you may, kind of get flustered in the moment or, kind of get off topic a little bit, or you just have a lot of questions. And so it's always good to brainstorm about what are possible questions you have with your family and your friends. Next, I want to talk about partnering to develop your medication goals. And so, similar to what Dr. Gonzalez Melendez had said, it's aligning on what are our goals. So, she shared what are some of the goals for uh, rheumatologists in terms of looking at the guidelines. But as people living with lupus, we may have different goals. We may be able to want to resume going to work. We may be able to want to spend more time, taking care of our chores around the house, or having more times, getting involving with our hobbies. And so we want to ask these questions to our pharmacists as well as, to our rheumatologists or nephrologists. We also want to discuss with them how are we going to define success? Is it something that am I going to see this in my lab values? And also, when is this going to work? Is this a drug that works within a couple of days, or is it going to take months or weeks? And that's important to know. And I always like to ask if this drug doesn't work, what are other options? Are there other options? And so I think kind of having those discussions can really help have a good conversation with your doctor. You also may want to ask your doctor, they hopefully have a lot of experience taking care of people living with lupus. You want to ask them, what's been your experience? You personally, have you seen other people living with lupus do better, and how frequently is that happening? And on the other side, in terms of side effects, when have they seen their patients coming back and reporting side effects and appointments, and how severe are these side effects? And so you want to ask your doctor a little bit about their experience in using certain medications before you go on them. And again, with medications, you want to have the discussion, is this something I'm going to be on chronically, or is this something, like steroids is more short term? And then also in the point about side effects, knowing, is this something that will go away on it by itself? Will I need to take more medications? Are these side effects only going to happen in the first few weeks, or will my body adjust and will these go away? I also want to talk about connecting multiple doctors. I know myself, I have to see multiple doctors for my lupus, and sometimes it can be frustrating as they don't often talk to each other. So some tips I have is that if they're in the same health system, like let's say they're in the same university, you can ask them to message each other and to share notes. And that's something, unfortunately, they may not always do that by themselves, but I think you can give them a little nudge and ask them to message each other and kind of consult with one another. If they're not in the same system, you may have to connect them and provide some information, but you should request that they talk to one another. So, both sides are kind of, putting their heads together and creating the best plan for you. And one tip is you may also need to send records, especially if they're not in the same health system, just so they have kind of your previous medication history, any hospitalizations, any lab records. You may have to send those across multiple doctors if they're not, again, practicing in the same practice or the same health system. As a pharmacist, a few things that I think, again, are important to talk about with your pharmacist and with your doctor in terms of medications. So one is illness. So, I know myself when I've got sick, sometimes I have to stop taking my immunosuppressants so my immune system can fight the infection that I have. And so that's a conversation you want to have with both your doctor and your pharmacist. Again, which medications are held for when you're sick and for how long are you holding them? And which over-the-counter medications can you take? Things like aspirin and ibuprofen. Like, are these things okay, or will they interfere with some of the medications that I'm on? Also for vaccines, if you're on immunosuppressants, your pharmacist and your doctor may administer them, and they may also request that you hold some of your immunosuppressants so you can let the vaccine uh, work within your body. And so you want to ask them, am I stopping this the day before the vaccine, for a week after? You want to have a plan with them before you're getting your COVID or your flu or other vaccines. Next, in terms of tapering, if we're on prednisone for a flare, asking for the full written taper schedule, I think so there's no confusion, because your dose may change on a week or a day by day basis. And so I think having your doctor or your pharmacist write that down, just so you're on the same page is going to be important. And as we have, taper our prednisone, sometimes we may have different kind of side effects. And so, or, kind of a recurrence of our lupus symptoms. And so that might, have us kind of go back up on a higher dose. And so it's important to talk to both your doctor and your pharmacist about how to adjust your prednisone if you have any, lupus symptoms or if you have any side effects. I also want to spend some time talking about, again, not so great part about having lupus, but it's really controlling the cost and insurance coverage. And so I think a good practice is whenever your doctor is starting you on new medication is asking them, in your experience, has this required a prior authorization until prior to patients getting approval for your medication? For a lot of these newer medications, they're being studied and approved. They will almost certainly require a prior authorization. And, someone who's today going through this now with one of my medications, this can take quite a while. And so I think understanding with your doctor that might be a process is a good proactive step. With insurance, they will often deny your medication and tell your doctor to submit a prior authorization. This unfortunately is normal, but I know it can be really upsetting to deal with. But I think, just anticipating this can help a little bit and asking the office, okay, so if I have a prior authorization, is there a certain member in your office I can call? What's the number? And just know that even if your medication is denied the first time, your doctor can still appeal. And it might be frustrating, and you may have to call the pharmacy, you may have to call your insurance, but persistence does pay off. Also, on the point about paying for the medication, some of these newer medications, again, can bring a lot of benefit, but often can also come with a high cost burden to those living with lupus. And so I encourage you to always look at the whoever makes the drug. They may have copay or co-insurance programs to really reduce your out-of-pocket cost prior to picking up the medication. Also, for some generic medications, you may also want to check out things such as GoodRx or Merck Cuban Cost Plus Drugs, which actually may be cheaper than you using your insurance. And so it's good to check out those things. Also, groups like the LFA and other patient advocacy organizations often have grants for people living with chronic illnesses such as lupus that they can apply for to help pay for either medications or other bills. So again, I know this is such a tough topic for our healthcare system, but you do have some control over this in terms of getting coverage through insurance and then paying for this out of pocket. Great. So some other tips for how to be your strongest voice. As Dr. Gonzalez Melendez had stated, keeping a log of your symptoms and your side effects, that is evidence. That's something that no one can take away from you, and that's your power. Again, our pharmacists and doctors are experts at understanding medications and diseases at a level, but you are, the expert at you and your disease, and no one can take that away. The next I'll say is bring an advocate. Again, I know it can be intimidating talking to, a doctor or pharmacist. Perhaps they're using some big words or things like that, and you're kind of just again so focused on kind of the news they're delivering. It's hard to process everything. That I've really found it's beneficial to bring a caregiver, and maybe they're not even there in person. Maybe you just have someone on the phone that they can take notes while you can listen, or maybe they can ask some questions that you forgot. So I think bringing an advocate, whether again it's on the phone or in person, can really, really, I think, help you out. Also to set boundaries, for provider over time, for a couple visits is rude or dismissive. Again, you're the CEO of your healthcare. It's okay to switch. It's okay to get a second opinion. You deserve, to not feel rude or dismissed during your appointment. Also, I have here kind of the set framework to help communicate some of your concerns. So your symptoms. So, like, we really want to try to be specific. So not just saying, I didn't feel good after taking that medication, right? It's okay. I didn't feel, I felt like my stomach was upset 30 minutes to an hour after taking the medication. You really want to get specific so both the pharmacist and doctor can kind of understand what's going on. You also want to share your experience. So maybe you've had a similar medication that you've taken in the past, um, you know, or, maybe you had, kind of an allergy, that's a food or, just like any type of allergy. Again, you want to share these things because your experience matters. And also the timing of when your symptoms started, either lupus symptoms or your side effects, you gonna, again, want to share the timing of these symptoms. So just kind of wrapping everything up and putting everything together. So here's a nice kind of like summary of the toolkit of confidence. So one, as I mentioned, preparation is power. Preparing for your interview, sorry, not your interviews, your appointments and your discussions, and having this written down somewhere, either on paper or virtual, I think can really set you up for success. Again, next is partnering with your pharmacist and your doctors to understand what are your goals, and then what are your plans for if I get sick or if I need a vaccine. You want to try to tackle all angles of that, or if you have to travel, for instance, what do we do then? Also, in terms of controlling costs and insurance, prior authorizations are really frustrating, but you do have opportunities to continue to appeal and appeal. But don't feel discouraged. There is help out there. And also in terms of setting boundaries and communicating concerns, again, you have the right to a respectful provider who will listen to you. You 100% do. So, I hope this was helpful. Again, thank you for your time and looking forward to ever joining everybody for the panel later.
Thank you so much, Brian. That was absolutely wonderful. There's so much that I would want to comment on after your presentation. First and foremost, I think that pharmacists are such a underutilized resource that we have, and just evidenced by all the information that you shared this evening. Um, I also want to mention, I know that talked about appeals, appealing those decisions if your medication gets denied. I don't have the percentage offhand, but I will say that a large amount of appeals do typically get approved once you do that appeal, right? So I know it can be frustrating, but it's usually well worth it. And then the other thing that I want to mention is if you do need help paying for those medications, we have a list of financial resources and a great guide also available on our website. So visit lupus.org and then under support and resources, you can find financial resources. Okay, so I will stop. I will go back to the agenda that we have this evening. And just real quick, I want to also talk about our Take Charge series. And so this is a 12-week educational email series. And it's for those of you that are living with lupus, especially if you're newly diagnosed. You will receive regular emails from our health educators that include practical tips, trusted information, and resources to help you feel more confident in managing your health and lupus. It's going to cover important topics like identifying and tracking symptoms, staying on track with your medications, and making the most of your doctor's appointments. Again, all aimed at helping you feel more informed and empowered. And I see that the links, we're dropping some links in the chat, so hopefully that can help you get to those resources. And then before we get to our next speaker, we have one last poll. So hopefully you'll all bear with us for one last poll this evening. You all have been very active. I've seen all the reactions coming up on the screen, so I appreciate it. And this final poll question is, what is the biggest barrier to effective communication with your care team? And the options are not enough time during appointments, feeling intimidated, not knowing what to ask, fatigue or brain fog, language or cultural barriers or other. And again, you can select all that apply here, and the same with the others. We'll give about 30 to 45 seconds to get those responses in. Okay, let's go ahead and share those results. So, we have 51% say not enough time during appointments, 17% say feeling intimidated, 38% say not knowing what to ask. And then we have 42% with fatigue or brain fog, 8% with language or cultural differences, and then 15% say other. And I'd be interested about the other. I know there are a lot of different reasons, right? So we will go ahead and go to our next speaker. We've already had two wonderful speakers, and I'm so excited for the next two speakers that we have as well. I know that we, like I said, have a lot of a full agenda and a lot of speakers, but they all have a lot of knowledge and expertise to share. So we have Dr. Joy McNeil joining us next, and she is a licensed clinical mental health counselor, career and confidence strategist, performance coach, professor, and speaker dedicated to helping people live with clarity, resilience, and purpose. A graduate of UNC Chapel Hill and Fayetteville State University, Dr. McNeil earned her PhD in counseling and human services from Capella University. Her doctoral research explored the delayed lupus diagnosis experiences of women of color, work that continues to shape her commitment to health equity and client resilience. Dr. McNeil has served in corporate, nonprofit, community mental health, and military settings. Her mission is simple: educate, empower, and elevate people toward their highest potential. Thank you so much for joining us, and I will go ahead and mute myself here.
Okay. Hello, everyone. Thank you so much, Ashley, for that introduction. My name is Dr. Joy McNeil. Ah, there's my slide. How gorgeous. When you're not heard, the emotional cost and how to reclaim your voice. Now, let me just take a minute. Everybody just breathe. Just breathe and unclench your jaw. Just do that for a moment. I'm inviting you to do that if you can, to just breathe, unclench your jaw, shake the day off, right? Because 2026 is new, happy new year, and still we have so much to do, so much to accomplish. And so when you get to a presentation like this, and I have enjoyed so much listening to my fellow presenters, when you get to a presentation like this, you really do want to just take a moment and kind of relax your body a little bit. So I hope that you're doing that. Let me know, send a reaction so I can see those of you who have decided to do that. So we're going to talk about the emotional cost of not being heard. I want to thank the Lupus Foundation again for allowing me to speak, inviting me to speak, and really kind of talking about, well, what does it look like to reclaim your voice? And so I loved what Dr. Gonzalez Melendez said. You're the expert on how lupus affects your life. Your doctor is the expert on diagnosis and treatment. And then Dr. Ung talked about building a medication master list and preparation as power. And so I'm just going to flow right into all the great information that we've already talked about tonight. And hopefully you'll learn something, take something with you, some interesting tidbit that you can use to really support your life's journey. So thank you to the lupus warriors that are here, caregivers, professionals. I am just so excited to be here. Okay. So I'm going to try not to mess this up. I'm Dr. Joy. As you heard, the one thing that I want to point out is I am a lupus thriver. I was diagnosed with lupus at age 24. It was one day before my birthday. right? And so then a few years later, not too much later, I completed my PhD in working with lupus thrivers who wanted to share their stories about the experience of trying to access medical services and noticing something was wrong with their body. And so I was able to talk to them about the lived experiences of having kind of a delayed diagnosis to lupus. And that was so powerful, life-changing for me to do that work. And so we're just going to talk some more about some things that came out of that work as well. We're going to talk about the impact of not being heard. I'm going to share with you the power of renewing your thoughts and reclaiming your voice. I also want to make sure to highlight rewarding your progress. How do you reward yourself when you complete medical appointments, when you do something hard, right? When you wake up in the morning? We're going to talk all about that. And then I want to talk about resilience. So if you have a notebook, you want to grab your notebook. I want to make sure to leave you with some questions for further deliberation that you can take with you. That's really important, as well as some resources. So, what are some stressors that we face? What are some things that we face? Whether it be financial, whether it be the symptoms we're experiencing, we don't know what's going on with our body. We are trying to get to these appointments. Traffic might be a little crazy. Then there's, social media. Sometimes it's the stigma of autoimmune illness, right? Feeling guilty for having to take time off work to go to doctor's appointments, medical appointments, or just to get a break because you're tired, right? So there's a lot of stressors, even unrealistic expectations, and just the changes that we all experience. So I want to put that out there because you may be experiencing one or all of these. Perhaps you're, a caregiver and you want to be able to help your loved one to thrive and support your loved one. Maybe you're managing young children, or trying to figure out if you can have children. There's so many different stressors that we face, and it's important that you take the time to look at, well, how do I want to manage? And that's what we want to talk about tonight. There is indeed a deep psychological impact of not being heard, whether you're feeling dismissed in a medical setting, whether you feel not heard from family or friends, right? That then self-doubt can kind of creep in, that internalized gaslighting of feeling like it's not okay to speak up. Sometimes some people emotionally shut down. Some people engage in people pleasing, and you've probably heard of the fight, flight, freeze, and fawn, right? Which is so important to look at. How is it that you are managing not being heard, or deciding, hey, I'm just tired of dealing with managing all of the day-to-day stressors, managing an illness that shows up at the most inopportune time sometimes, right? This and then also this avoidance of care, not wanting to go to appointments, not wanting to engage because it's hard. Sometimes we feel like we're not heard, and then there can be a roller coaster of emotions that go along with that. And that's normal to experience just different kinds of emotions. So when an appointment goes sideways, and I know because I've been there, right? It's important to kind of look at, well, what do I want to do differently, right? So we know that lupus thrivers report challenging medical encounters from time to time, feeling rushed, right? Symptoms being minimized, kind of being talked to rather than partnered with, and leaving appointments feeling unseen and unheard. Now, I don't know about you, but I think that it's important to kind of look at well, okay, if this has left me this way, what do I want to do to build confidence to be able to reclaim my voice, right? What do I want to do? How do I want to handle this? And then how can my support system help me manage this? So I want you to imagine you're walking into an appointment, you feel grounded, you're prepared, like some of the other panelists have talked about, right? You feel respected, you respect yourself, right? When you think about a great appointment, and I hope all of you have had at least some of those, right? I hope that the majority of your appointments have been fulfilling for you. But here's the thing, if I can envision this appointment going well, my provider listening without interrupting, my symptoms taken seriously, my questions welcomed, then that means I'm going to leave that appointment with clarity and not confusion. That's the goal. And I believe that that experience is reasonable and achievable. It doesn't have to be always that the appointment goes sideways. So I want to really introduce that positive intention into this, that what you can imagine can actually come true. What you envision can actually come to fruition. So I want to make sure to say that. Now, I want to talk about the way forward. We're going to talk about your support system and renewing your thoughts, how to cognitively reframe. We're going to talk about preparing, as well as how to speak with confidence and clarity, to ask questions with precision, the importance of caregiver presence, and also summarizing the appointment as well before you leave. And then I will also give you kind of a list of ways to reward yourself. So let's talk about renewing your thoughts. It doesn't mean minimizing your pain. It means reminding yourself, hey, your symptoms are real. This isn't imagined. What you're experiencing is really happening. It's real for you, right? And you're the expert in your body. Your experience with lupus, your just your story matters. And so you deserve attentive, respectful care. And I think it's also important to know that your voice is worth hearing. I want you to think about that when you start to feel this sense of dread in speaking up, to remind yourself you are worth hearing. Your story matters. Those things are important. I also want to talk about the importance of having a support system. And I can tell you, I am so grateful my mom can attend some of my appointments with me, because there are times where she may have a question that I did not think of, right? Or she may be able to summarize if I'm having brain fog or whatever is going on. Sometimes, we feel like, there's a question on the tip of our tongue and we can't quite get to it. And so that can create anxiety or what have you. And so having someone in a support capacity to be there with you, someone you trust, right? To be there with you, um, getting the education and getting that mental health support is so important, because support and asking for support is not weakness, right? It is strategy. It is strategy. If you want to really kind of get what it is that you want out of your appointments, what it is that you want out of, the things that you have going on, I want you to keep in mind support is a big part of that. And so I want you to think about, two or three people in your life that you trust that may be able to attend appointments with you, help you prepare for appointments, or have an after action report about those appointments as well. The other thing is, we got to shift the internal narratives, right? To be able to restore confidence. Oh, I'm really bad at explaining my symptoms. Oh, I don't want to be difficult. I don't want anyone to think I have an attitude. I don't want that. And it's always about what we don't want or what we can't do. And instead, I want you to shift to reframe to, yes, I deserve time and clarity. Let me move through these symptoms. Let me ask the questions because I'm worth it, right? And I want to make sure my voice is heard and that I'm getting the best care and the best for me at that moment, whenever, whatever that is. I want to be understood. I want to understand others. I want to, understand my medical provider. All of these things are important. So the next time you are in that negative spiral, like, starting with I'm bad at explaining my symptoms, the insecurity that comes in, the anxiety, depressive symptoms start to flow in. When you're in that negative spiral, I want you to think about how to reframe so that you can get with just get into the mode of I do deserve the clarity from my provider. I believe that I will be understood, and if I have questions, it's okay to ask them as well. Preparation is key, and as the other panelists have talked about, documenting your symptoms, prioritizing your concerns, bringing your notes with you, and also, as I talked about at the beginning of this presentation, taking a calming breath before you begin speaking. Take a breath, take a beat. It's okay. Confidence begins prior to the appointment. That's how you reclaim your voice. That's how you walk into the appointment, the difficult conversation, whatever it is. That's how you get in there. Because you're prepared ahead of time. You've thought through some of the things that you want to say. And I think that that's really key. The other thing is you are the expert, as we've talked about tonight, your lived experience. And I want to say that, making sure that you're advocating on behalf of yourself and that you clearly communicate what you need, because that invites the collaboration and building relationships with your providers. Your voice deserves space. That's so important. That's so important that you work on making sure that you're the expert on your body, your symptoms, your lived experience. And so I want to just impart that into you today. And it's great that we're here in January in a new year, because this is a great tool to take to go forward, which is the notion and the knowledge that you are the expert. Okay, and so along with that is speaking with confidence and clarity. Clear, concise language. And I'm one of those people, I have to sometimes write out exactly what I want to say, because if I don't, sometimes I might get off track, go down a rabbit hole, forget to say something that I should have said, right? So clear, concise language includes the symptom affecting my daily life most is dot, 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 and really kind of filling in the blank for that. What I need clarity on today is dot, 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 whatever those things are, right? I want to be sure that I understand the plan. And then sometimes, you turn to your support system, your caregiver who's with you, your family, your loved one, and say, did you understand? Or, what is your understanding of, right? And so slow, steady speech communicates confidence. You all still with me? I want to make sure you're with me. We're rolling through this, and I know that I'm speaking, moving through these slides rather speedily, but I really hope that you're with me. So thank you so much for that. Asking questions with precision is also important. Strategic questions improve shared decision making. For example, what are we ruling out? What are the risks? What are the benefits of this option? What is the plan if this doesn't improve? Those are precise questions because, again, these are collaborative. They're not confrontational. I don't know how many times I've heard people say, well, I don't want them to think that I have an attitude problem. And it's like, well, okay, we certainly hope that they don't because we want to invite them in to share, invite the providers in to share what these lived experience have been for us. And asking questions that invite more elaboration is so important as well. We've talked about caregiver presence. We've talked about, and I know my mom sometimes takes notes for me because sometimes it's hard to listen and take notes and process at the same time. And so advocating respectfully and your caregiver really doing that really is just it's quintessential to this process as well when you can. And if you're there by yourself, also knowing that it's okay to feel anxious. It's okay to feel nervous about the appointment, but it's also okay to make sure, right, that you are taking your time, slow and steady, asking questions, making sure that you leave with a summary of what's been discussed as well, because that's important too. Here's the summary, because we got to summarize the appointment. Summaries reinforce understanding. So today we decided, and whatever that was. The next step is, and whatever that is, and we will follow up in whenever that time is. And I think that that's important to reduce your own confusion and support follow through. And also key into your memory bank as well. What happened, what you remember, and things like that. So I hope that that's helpful as well. Now, when the appointment is over, when the courageous conversations are over, when, those hard, difficult conversations happen, I want you to remember you should be rewarding yourself. I highly recommend that to give yourself a rest. What's your favorite meal or drink or snack? Maybe, you decide to go for a long walk if you can, right? Or just journaling. I tend to buy myself a lot of journals, some of which I have never opened, but there's something about just being able to journal, to write, to be creative that for me is just the best. And so, yes, medical appointments require a lot of emotional labor on our part. And so how are you rewarding yourself? What is one thing that you do after your appointments, after some difficult conversations to remind yourself, "Oh no, it's okay. It's all right now. I am going to take care of me because I matter," right? So, if you have not pulled out your journal, I want to take this last few minutes because I want to be respectful. I know we have a Q&A. If you have not taken out your journal or something to write with, I want you to look at the 10 facets of resilience, right? Because we're all resilient. Everybody on here has had to build back, right? Has had to overcome challenges, disappointments, relationships ending, relationships beginning. Some of us have experienced trauma and things like that. And so I want to talk about how it is that we get to a level of resilience where we see the journey, right? And we embrace, yes, I've been through so many things, but I'm still here. And everything that I can imagine is possible. Yes. So we're going to talk about the ability to self-calm. I'm going to give you some questions for journaling on self-replenishment, being non-judgmental and self-supporting, optimism, hope. All of these things are the facets of resilience. And I think that it's important to know that because sometimes we talk about this resilience muscle, but some people are like, well, what does that mean? Right? And so I want you to look at, if it'll let me, yay. Okay. What calms you and makes you feel confident? What are some ways that you show your body that you value it? How do you replenish your energy bucket? I want you to take time to notice where emotions are showing up in your body. Because I know, sometimes anxiety may show up in your gut and how it is that you're processing. There can be headaches or just feelings of depression that make you not want to get out of bed along with any symptoms that you might be feeling, right? And then, yes, you want to take time to look at how these emotions are showing up. And then I want you to ask yourself also, what is one sentence that you can say to support yourself and your journey? And your journey. Because it's important to make sure that you have a mission statement for yourself as much as anything else. Something that you can say to self. You can do this. I believe in you. Whatever those sentences are that give you life and make you feel confident that you're reclaiming your voice. And also, I want you to think about, what strengths and resources do you hold to face the challenges in your life? Consider writing a story, a hopeful story about your future self. Focus on what you can control. What are those things you control? We tend to focus a lot on what's outside of our control. But I want to invite you to start to look at, but what's in your control? Because that also helps you communicate with confidence. Another thing that I think is important is, you know, two truths can be true at the same time. I can feel like I'm not doing enough with my life, like things may not be, where I want them to be. But I can also focus on what I'm doing what I can in this moment. I'm doing the things that I control. I'm in control of, and that's enough. So two things can be true at once. It's not one or the other, right? It's not black or white in terms of this or that. Sometimes it's this and that as well. And I want you to write those truths for yourself as well as for social support, really looking at, do you find yourself dumping or discussing? Who is there for you? What are your boundaries? And I really want to make sure that you have them because you've got to manage so many facets of life that if you're not setting boundaries, I want to invite you to do that, to let your yes be yes and your no be no. Because sometimes, late at night, if folks want to talk, I know, some people want to talk with me in a personal capacity about what's going on. And sometimes I just say, no, I got to get some sleep. I've got to get some rest. So, as we're wrapping up here, I want you to take that time and journal. I want you to really take the time to journal about your experiences, what your needs are, how you can be supportive. I want you to look at your preparation and make sure that, oh, I love all the reactions, and make sure that you are prepared for appointments, that you are emotionally grounded, right? Breathing, and try not to let yourself go off into the negative spiral that we can so easily do. So I want to remind you, you're not too much. Your symptoms matter. Your questions matter. Your voice matters, right? And you are worthy of care. You're worthy of care. If it's possible for the team to drop the resource guide, I put together a resource guide, so hopefully it'll be dropped in the chat because I wanted to put together some resources just for you to let you know that you don't have to navigate this alone. Make room for your mental wellness. Talk to a provider, a therapist, talk with your medical provider and really dive into what's important for you. Don't put yourself on the back burner, right? And so I also wanted to make sure that if you need it, that you do have my contact information. And so I want to thank you all again because I believe that you can reclaim your voice in 2026. That's what we're going to work on. We're going to work on confidence. We're going to work on preparation. We're going to work on asking clear questions and really managing these emotions. And so I just want to make sure to put that out there and to say, I believe in you as much as I believe in myself. And I believe this year is going to be so much better than last. And I hope it is for you as well. So shout out to all the lupus thrivers and caregivers that are here. And thank you again to the Lupus Foundation of America for inviting me as well.
Thank you so, so much, Dr. McNeil. That was absolutely fabulous. I wish that we had more time to spend on everybody's presentations this evening. I see all of those reactions really rolling in. I am going to do my best once we get to the next speaker to get that resource guide, hopefully in the chat. We've been having a little bit of technology issues, so hopefully it'll let me attach it. As we are getting towards the last 38 minutes of tonight's program. I just wanted to share one last resource or program kind of resource for you. So we have our support groups here. So if you're looking for that safe, supportive environment where people truly understand what it's like to live with lupus, this is such a great resource for you. So we have the QR code there so you can go and learn more about it. You can ask questions, listen to others, and offer support to one another. That's a welcoming, understanding environment. We have a variety of support groups to meet different interests and needs. Most of our support groups meet virtually online, so you can join from your home or wherever you're most comfortable. Again, I encourage you to visit our website and find a group that's right for you. And if you haven't picked up on it yet at this point in tonight's program, a lot of our presenters are also support group facilitators. So Dr. Gonzalez Melendez is our Puerto Rico support group facilitator. Brian is our Man Cave support group facilitator, one of them. And then our next speaker, Raquel Dozier, is our Virginia Lupus and Color support group facilitator. So I'd like to go ahead and introduce her. And she's going to be such a great speaker to really pull everything together and wrap this up for us before we get into our panel and Q&A. So, as I mentioned, Raquel is the founder of Lupus in Color, a global movement dedicated to educating, inspiring, encouraging, and empowering lupus warriors worldwide. Diagnosed with systemic lupus erythematosus in 2004. After years of dealing with one diagnosis of rheumatoid arthritis and near fatal complications, Raquel transformed her pain into purpose. Seeing the lack of lupus awareness and support for Black women, she created Lupus in Color to build community, amplify voices, and provide education and empowerment for those living with lupus. I see all those hearts. This is amazing. Living with lupus and other autoimmune diseases. She's a retired social worker, counselor, author, certified meditation facilitator, and patient leader. Raquel also serves as a Lupus Foundation of America ambassador and, as I mentioned, regional support group facilitator. Through her advocacy and storytelling, she continues to be a powerful force for awareness, equity, and healing in the lupus community. So thank you so much for being here, and I can't wait to hear your presentation.
Thank you, Ashley. Thank you so much for that wonderful introduction. Like Ashley stated, my name is Raquel Dozier. I'm so excited to be here. All of the information that has been shared, and I'm a social worker, so I'm used to taking notes. And I just want to wrap up kind of what everyone was saying. Dr. Melendez talked about open communication and trust and honesty. Dr. Young talked about medication, master medication lists, all these different activities that you can do to navigate the healthcare system. Partner, that was a main theme for what we're discussing today, partnering with our pharmacists, with our doctors. And then Dr. McNeil came in and said, look, we have to have the power of renewing our thoughts. And when we get that power of renewing our thoughts, we can then begin to navigate the healthcare system in a way that is very helpful for us. So like Ashley stated, I am a retired licensed clinical social worker. Look, I'm a medically retired social worker because 21 years ago, I had to stop working and I was so sick with lupus. It was ridiculous. So I'm so excited to be here to be able to share my experience as a social worker. So, we all have rights as a patient. And we heard the doctors talk about the different guidelines. We heard them talk about preparation is power. So this is part of that preparation to get you to understand what your rights are as a patient and how you can navigate that system that comes with this whole lupus experience. So people with lupus, we know we often face those difficult fragmented healthcare systems. We have so many different things that we're dealing with, whether it be biases or whether it just be not being able to get to a doctor in our area, having to travel so far. Sometimes our symptoms are invisible, they're fluctuating, they're mimicking different other health issues. And practical tools are the most important thing to improve the safety of yourself as well as the outcomes. So the goal is, as you navigate your healthcare, is to be an empowered and engaged patient through enhanced communication. We heard that from the doctors, that communication is so important. And partnership, here's that word again, partnership. We have to be a partnership with our healthcare professionals. So what are your rights as a patient? Let's just get right to it. You have the right to access to care. You have the right to receive the care with reasonable access to treatment. You have the right for respectful treatment. You have the right to be treated with dignity and without discrimination, because we know in the healthcare system, there is a lot of discrimination that can happen. You have the right to quality care. You have the right to receive appropriate high quality, you hear me? High quality care in a safe environment. You want to be safe. You want to receive the care that you deserve. Privacy and confidentiality. Your medical information must be kept private and confidential in accordance to the laws of HIPAA. That's really important that you understand that for yourself. Informed consent and decision making. You have the right to clear explanations. I can't remember which doctor stated it, but you have the right to have those clear explanations about diagnosis. I saw a question in the chat. If I don't understand what my doctor said, is it okay for me to ask again? Absolutely. You ask and you communicate until you understand clearly what he is stating to you. And 6, access to medical records. You have the right to access your medical records and request notations and corrections. Don't be afraid to speak up for yourself. Once you get to the power of renewing your thoughts, like Dr. McNeil stated, then you are able to advocate just a little bit better for yourself. So in advocating for yourself, it can be a little scary. It can be difficult. But we know that communication is the most important as you navigate that healthcare system. It's important to do this effectively in order to be understood fully, okay? We want to make sure that they hear us. We want to make sure that they understand us. And we want to give them that same respect back to hear them and understand them as well. Dr. McNeil touched on this a little bit. Use clear, calm, and factual information. Frame your concerns around safety and quality of life. Look, Doc, my quality of life is being mitigated by everything that's going on in my life. Let them know that. Ask open-ended questions instead of making accusations. Oh, you're not listening to me. Doc, I feel like you're not really listening very well to me, and I'm feeling a little bit dismissed. Bring your notes. We talked about this earlier. Bring your notes, symptom logs, written questions ready. I always say to anyone that goes into the doctor, have your 3 most important questions ready so that you can hurry up and get in there and get the most important things taken care of, because we know they only have a certain period of time that they can be with us. And remember, you are advocating for your health. That is a skill, not a personality trait. It's something that you have to learn to do consistently and effectively for yourself. And with advocating for ourselves, we're going to go through some different things. We're going to go through some medical gaslighting. And we all know what medical gaslighting is, right? Medical gaslighting is when a doctor or a healthcare provider doesn't believe a patient's symptoms or concerns, making a patient doubt their own experience. Sometimes we even gaslight ourselves because we're being gaslighted by the doctor. And we want to make sure that we understand the signs of that and how to mitigate that. Some signs of medical gaslighting can be symptoms are minimized or dismissed, being told symptoms are just stress, or let me go back. Ooh, I'm clicking stuff that I shouldn't have been clicking. Feeling stressed, that it's just stress and not related, to the proper evaluation of your actual health issue. Feeling blamed for your illness or outcomes, frequent interruptions or refusal to answer your questions. This is probably something that many of us go through because they're rushing to get us out. We have to make sure that we know we can see the signs of that medical gaslighting. Being labeled as difficult for asking for clarification. Look, this is your life. Everybody said it. You're the CEO of your healthcare. You're the expert on how it affects you. I'm just pulling it all from everything that we were talking about earlier and putting it in one little clarification for you. So you're not, even if you're seen as being difficult, still ask your questions until you're clear. Don't be afraid to do that. We talked about the emotional toll of not being believed, feeling dismissed. It can lead to anxiety, anger, hopelessness, and even not even going back to the doctor, right? Repeated invalidation may increase stress and lupus flares. It's normal to grieve the trust in the healthcare relationship. Some of us may have had some difficult relationships with doctors, and it causes us to have some health PTSD, which is real. So we have to make sure that we understand what those emotional tolls are and understand that your feelings are valid and understandable, totally understandable, especially as you're dealing with this unpredictable disease. So coping with the emotional impact, Dr. McNeil kind of touched on some of this stuff. So some of this stuff might be repetitive, but seek peer support from others living with lupus. Find that support group, find your tribe, find the people that understand you and hear you. Work with a mental health professional familiar with chronic illness. Don't be afraid to go find a therapist. It's okay. We all need someone to talk to. Practice self-compassion and grounding techniques. This one is important because I think that sometimes we're so hard on ourselves, and we have to practice that self-compassion and that grace, giving ourselves grace and finding those grounding techniques like Dr. McNeil stated about the calming breath and things of that nature. Reframe your advocacy as an act of self-respect. You don't have to call yourself an advocate, but you do have to respect yourself enough to go in there and take care of the things that you have to do for yourself. And celebrate moments when your voice is heard. Celebrate the small wins. The doctor listened to me and he understood what I was saying. I'm excited about that. Let's do it, So sometimes we cannot go past all of those issues of medical gaslighting or a doctor not listening to us, and we have to file a complaint. It's not always the best thing that we have to do, but sometimes there are ways that you can file complaints if you feel mistreated or you feel that your doctor is not listening to you. Some ways you can do this is start by asking to speak to a supervisor or a patient advocate. Request a facility's formal complaint process. Be specific when you do that complaint and include factual information as well as dates and names. And that goes back to what every doctor that spoke tonight stated, to make sure that you have somebody with you just in case you need some help advocating for yourself. Keep copies of all your correspondence and escalate any concerns if they're not addressed. And there are some links here that you can go into the Centers for Medicare and Medicaid Service website, or if you have some billing issues, how to medical bill rights help submit a complaint. And we don't always want to do a complaint because sometimes it just makes it more difficult for us to find that care, especially if we're in a rural area where we only have one doctor and we have to work with this doctor. So you have to make sure that you're voicing your concerns to your doctor, asking that doctor, what is your differential diagnosis? What's going on? How did you come from me having lupus when I came to you and now me not having lupus when I came to you, So here are some tips for caregivers, because we know that sometimes we're going to have to bring somebody with us. And sometimes we need assistance in advocating and caring for ourselves. Our caregivers can help get the care we need. So for those caregivers that are on the line, ask for permission and understand the patient that you're with what their wishes are. Make sure you understand all that. Take notes and help track symptoms. We talked about all of this earlier. Speak up with the patient is when the patient is fatigued or overwhelmed, because we know lupus can be overwhelming, especially when you're going to the doctor when you're tired and you're sick. Use we language. Make sure that they understand that it's a partnership. That word has come up all night, a partnership. Caregivers also deserve respect and clear communication from you and from the doctor. Take time for yourself so you do not burn out. So there are also supportive resources available. And I know I'm going through a little quickly, but this will be sent out to you so that you can read it at your own pace. But other than caregivers, there are supportive services that can help you along your journey. Patient navigators, hospital social workers, ombudsmen, patient advocacy organizations, care coordination services, and local social service agencies. Don't be afraid to reach out to someone that you see in your neighborhood that might be able to help you, that might know the social services area or a patient advocacy organization that you actually deal with day to day. And just my closing thoughts, navigating healthcare isn't about having all the answers. It's really about having all of the right tools. And like I stated, we heard from 3 different doctors that gave us such great information: open communication, trust and honesty, educate yourself, partnering with your doctor, with your pharmacist. Preparation is power. Positive intention and a shift in the narrative. Sometimes we have to change who we are in order to make sure that we are advocating appropriately for ourselves. So don't be afraid to change the way that you think about how you are dealing with lupus and how you are advocating for yourself. Look, you deserve care that listens, believes, and partners with you. You deserve to be supported. Advocacy is a tool, it's not a burden. You should want to advocate for yourself. And if you're not well enough, you should be able to talk to someone that can help you do that, because support systems matter for patients and caregivers alike. And just know that you are not alone on this journey. We are all here. We have 300 something people on this call that are here supporting you. The Lupus Foundation of America is supporting you. The doctors that were speaking are supporting you. Everyone here is here to be your support team. And if you need help, all you have to do is reach out. So in closing, I think if you take anything else from this discussion tonight, the discussion you should take is partner with your doctor. Sometimes your doctor has to be your friend. You are the CEO of your healthcare. I love that Dr. Ung said that. And you have the power of renewing your thoughts and not minimize your pain. So thank you so much to the Lupus Foundation of America for allowing me to speak with you all. I am available to talk anytime. You guys know where to find me at Lupus in Color. Thank you, Ashley.
Thank you so much. That was so wonderful. And I'm so glad that you were able to really pull that together. I had a feeling when we rearranged the agenda that it was the perfect spot to just synthesize everything everyone shared this evening. I hope you're able to see all of the love the speakers are giving you in that and with their reactions. And so as we close out, as our speakers get ready to join us we're going to combine the panel and the Q&A just in the essence of time. And really they're so entwined. I think it'll flow nicely to have it together. But I just wanted to share that we do have our National Lupus Advocacy Summit coming up in Washington, D.C. The dates for 2026 is April 19th to the 21st. And so, you can join us. You can visit our website to learn more. Even if you're not able to join us in Washington, D.C. during those dates, please visit the website. We need people to advocate for us year round. So you can sign up to be an advocate and get the latest alerts on our website as well with signing up. I also just wanted to take a minute and let you know that we would love to hear if you've attended any of our other events or if you've used any of our program services, support groups, We would love to hear how the Lupus Foundation of America has made a difference in your life, even if it's attending this and hearing these wonderful speakers. We would really like to hear your story, and hopefully that story can inspire others to help raise that lupus awareness. And I'm going to drop in the chat, hopefully seamlessly while I'm talking, the link if you're interested in sharing that story of impact with us. So once again, thank you to all of our speakers, and we're going to invite them all back on camera and to unmute themselves, and we're gonna make the most out of this time that we have left this evening with questions, and hopefully we can pull in that that personal perspective and experience with these questions that we received. But again, thank you everyone so much. And I also see in the chat, I'm sorry, I digressed quickly. Your feedback is also super important to us. It's what helps shape these topics, and how we plan these events. So if you have a moment, it only takes a couple minutes after the event, please fill out the evaluation so that we can continue to do these events and bring you topics that are meaningful to you. So as I mentioned, we're going to go ahead and combine that panel and the Q&A because they really do go hand in hand. And so the first question that I have is for Dr. Gonzalez Melendez. And my question for you as a physician, a rheumatologist, internal medicine doctor, how has lupus influenced the way you communicate with your healthcare providers? How do you prepare for those appointments and advocate for your needs?
As a patient, well, for me, I think it's easier now. At the start of the condition, if I think when I was only a patient, I've always considered myself a nerd. So and I've always been very organized. So I tend to, the same advice I gave everyone in here today is the same advice I used as a patient when I started this journey. Maybe at first, being 15 years, I didn't feel that confident to open up to my pediatric rheumatologist. But as time went on, we developed a very close relationship. I still, even though I had to move to an adult rheumatologist, I still have communication with her. So yes, I think I had a blessing of the physicians that took care of me when I was solely a patient. But as, as mentioned, I followed the advice of, having my list of medications, having a record of my symptoms. I have lupus nephritis. So unfortunately, when you have lupus nephritis, you don't feel anything or you don't see anything in your body. You're going to see the difference in your labs. So I think everything that I do now with my patients are things that I learned from my rheumatologist, my pediatric rheumatologist, and my adult rheumatologist. So yeah, I did the same things that I advise today to you guys to try and do in your appointment with your physicians.
I love that, practicing what you preach tonight, and that's great
Yes.
advice. Definitely. On the same kind of thought, Brian, how do you personally navigate complex medication decisions with your pharmacy background?
Yeah, I think I'm privileged to understand these things at a little bit of a deeper level. But because of that, and I also would say, even if you don't have this background, I think just understanding what questions to ask, and like I mentioned, asking your doctor, okay, have you used this medication with other people living with lupus? How have they reacted? So I try to ask them, what did the studies say? How is this going to make me feel better? I've been on several different medications for my lupus nephritis. Not all of them have worked. Right. And so I've had to have the conversation, okay, like, when is this going to work? Is this going to work in a month? What are my labs showing? And so, again, I similar to what Dr. Gonzalez said, it's been something I've developed over time. When I first had my autoimmune disease in my early 20s, I think I was kind of still in denial, didn't take things so very seriously. But then, as your health becomes more serious, you're in the hospital and that sort of thing, you kind of learn to into control what you can control, such as the medication list and preparing for the interviews. And so that's the approach that I still try to. I'm not always perfect, but things that I try to continue to this day.
Definitely. It's definitely a learning process and takes some time, and with practice we get better with making having those conversations and making those decisions. Raquel, how about you? I'm going to touch a little bit on part of what Dr. McNeil talked about, but how do you personally manage an emotional toll of feeling dismissed or unheard in your personal medical appointments? Have you experienced that?
I'm gonna tell you, I'm a little vocal, so I very rarely back down. If I don't understand something, I'm going to ask the questions that I need to ask and get the answer that I need to get. So as far as being dismissed, if I feel dismissed, my doctors understand. If I bring my husband, it's on like butter popcorn. He's here to speak for me. He's here to hear what I don't hear or explain to me what I don't understand. So as far as being dismissed, I haven't really had that issue. Once I speak up, the doctors listen. As far as trying to just navigate the emotional toll, I do a lot of meditation. I do a lot of journaling. I do a lot of prayer. And I do things, I've changed my mindset from the first moment that I was diagnosed. I call it maturing on your lupus journey. As you grow older, you mature, just like any other person in the world. But as you deal with different things, as you have different brushes with death, you mature as you deal with lupus, and you learn those coping skills that work for you. And for me, meditation, breath work, prayer, humor, all of that helps. And it helps for me to help someone else that might be going through the same things that I have gone through. So those are the things that I use to cope.
Definitely, I love that. And I love that maturing with lupus. I hope somebody that's working in the background wrote that down. Maybe that'll pop up in the future because I really liked that. And then I want to make sure that I talk to everybody. Joy, what about you? I know that you went through a lot of strategies, but I'm curious about personally, which strategies have helped you feel confident and empowered in your care? Because I found myself, as you were talking, saying yes to myself for a lot of the things you discussed. So I'm curious how you apply that in your personal experience with appointments.
That's a great question. Yes. In appointments, I think, well, the preparation for appointments, I read affirmations or create affirmations to say to myself as I'm driving there, when I get there. And then prayer is important as well for me. I like to have my medication list handy. Sometimes I take my whole bag of medications. Sometimes I just have to do that as well. Um, but I'm a creative, so I love to write. I love to journal. I'm a poet, and so I find that that is a way to really get through some of the tougher parts of appointments and understanding and things like that, is to make sure you have a flow and outlet. And for me, that's been really, really important, because as an introvert, and some of you may be introverts, I'm introverted. One of the things is I derive energy in my alone time. And so, I like my quiet time to just be able to kind of recharge that battery. And I think that that's important as well when just talking about getting to appointments, making sure they're successful. And I like what was said about maturing with lupus, because as a young person 20 years ago, um, I was just, deer in headlights. But as time has gone on and you have to trust your own process, that you do mature, you figure out what works, what questions work over time. And that has been really helpful. So where I was And now where I am is different. And I have really, when I look back, I have tried to make sure I love myself every step of the way.
I love that. That is great. And I see the reactions coming in. So we also, we have the Q&A. We also had an opportunity for people to ask questions during registration, and there are always common themes. So not to switch gears too much, but I want to make sure I hit some of those common questions as well. And we had a lot of questions about how to navigate getting your entire healthcare team on the same page, or what's the best way to have my doctors communicate with each other. And Brian, I don't know if you have any suggestions for that, or Dr. Gonzalez Melendez. I'm sure that you all have navigated this as well and probably have some practical tips.
Yeah, I'm happy to share. So, I think one, I'm fortunate enough to have a lot of my care team, my rheumatologists, nephrologists, other specialists within the same healthcare system. So I think, that makes it a little bit easier. They don't always, talk to each other. So I've learned, in my appointments, let's say with my rheumatologist, kind of referencing, hey, I just saw my nephrologist 2 or 3 months ago. He said this. What do you think? And would you mind following up with him or her after the appointment? So kind of like giving them things to do also, and kind of asking them both the same question and hopefully getting similar-ish, kind of answers is some things I've tried to do. When I also try to like periodically, within my electronic medical record, like my chart, I try to download the records. You can download them, put them on like a hard drive. So when I do see someone that's outside the system, I give that to them before my appointment, or email it to them or send them a link and let them comb through it. Try to take the work out of myself. But sometimes you do have to kind of connect the dots.
Thank you. And the next question that I've seen come in, and I'm actually going to take a little bit from our poll that we had. A lot of people said that one of the challenges they have is not having enough time for within their appointment. So Dr. Gonzalez Melendez, do you have any suggestions or takeaways? I know some things were mentioned throughout this evening's program, but what can people do if they're going to appointments and they're feeling rushed? What can they do to help like get those concerns addressed, or even to be able to talk about them during their appointment?
Well, I will recommend two things. One is prioritizing your concerns, because, yeah, definitely we may not have the time to answer all the questions in just one appointment. So prioritizing those concerns are important. And the other thing is maybe asking the physician, oh, doctor, maybe we didn't have the time to cover all my concerns. Can I schedule an earlier appointment instead of every 3 months in the next 4 weeks? I try to use a lot for that telehealth. Um, that's a way for me to maybe talk on those concerns that I couldn't address on the one-on-one appointment.
I love that. Very good. Raquel, I'm what's I've heard a lot of thought about getting a second opinion. I'm going to come to you and say, do you have experience with getting a second opinion? I know you said you're very vocal. Do you have any suggestions? When is it time for a second opinion? Or what's a respectful way that you can go about getting that a second opinion and navigating the healthcare system?
You know what? Getting a second opinion is important because sometimes you just don't feel like you're being heard. I mean, that was the whole thing of this whole being your strongest voice, right? Um, you need to get a second opinion if you're not feeling heard, understood, if you're being misunderstood, if you're being told that it's all in your head, if you're being medical gaslit. You need to find another doctor, and you need to find someone that's going to listen to you and that's going to work with you and be your friend in your healthcare so that you can go on and get the treatment that you need that is appropriate for you. You want to make sure that the doctor is actually helping you and not lupus itself. If you get what I'm saying, everybody has lupus, but it manifests and it does different things to everybody. So you want to make sure that that doctor is actually helping you and understanding where you are coming from and what you know about your body and working with you in that way. And if they're not doing that, then it's time to find another doctor. Unfortunately, though, as I said earlier, when you're living in rural areas or if you're living in areas where there aren't many doctors, then you have to have that communication with your doctor. Look, doc, I'm not feeling really comfortable with what you're saying. I think we talked about this, Ashley, on a different different activity. But sometimes doctors are saying, "Oh, now you don't have lupus." One doctor told you you had lupus. The other doctor said now you don't have lupus. But it's because you've had the medication in you and it's leveling it out. So you just want to make sure that you're having a full communication. Dr. Gonzalez Melendez said that you have to have that honest and trust. And that's most important. Once you can, facilitate that in your healthcare, then you're able to really have that discussion that, look, I don't feel heard, I don't feel understood. So I'm going to take my medical records because you have that right. We talked about that earlier. You have that right to have your medical records. And I'm going to seek someone else to help me because I don't feel that you are helping me personally. I think that you have me in this little group and you're not hearing what I'm saying.
I love that. That's great. And I'm going to ask two more questions very quickly, hopefully, but I want to make sure that I get a couple more in. Dr. McNeil, for someone that's been ignored in the past, how can they rebuild that confidence to advocate for themselves?
Yes, for someone who's been ignored in the past, feeling down, feeling, medically gaslit, feeling anxious, I think, one way to rebuild that confidence is to, prepare for your appointments, as we talked about, right? Making sure that you're prepared, talking to a therapist, a clinical social worker, a counselor. I know sometimes, even I do that, right? As a therapist, I have a therapist. And so I may talk about some of my concerns and work through and process them with my therapist. And so, I believe in the power of, again, building your support system. And so if you do need to talk with someone, if that's something that's important to you, that can actually help rebuild your confidence in terms of reclaiming your voice after you have experienced some tough times with providers. And so I do hope you consider that as well. And it's okay to not be okay. And that's why there are clinicians out there who will help you process through and give you some coping tools and strategies that you can use to move forward.
That's fantastic advice. I love that. I know that we are almost at time, but I want to give you all each, if you can take 10 to 15 seconds, what if somebody only takes one thing away from tonight, what would that be? And then we'll go in the order that we presented this evening. Dr. Gonzalez Melendez.
Yes, I think my first slide would be, what I told earlier. You are the expert on how you process and what you are feeling every day with lupus. Doctors are there for you. We are tools for you to diagnose and treat you. So feel confident and free to ask us as physician whatever concerns you may have of your condition.
Great, thank you. Dr. Ung.
Preparation is power, and you are the CEO of your healthcare.
Great, I love it. Dr. McNeil. Uh-oh, she might be frozen. She's frozen for me. Raquel, we'll go to you.
Okay, here I am. Who we going to, me?
We'll go to you. We'll go back to Dr. McNeil afterwards.
You are worthy of having health care and worthy of being seen, heard, and understood.
I love it. And Dr. McNeil?
Yes. Just know that your voice matters. And so I encourage you to speak up, to speak out, and to know that you can conquer the mountain of talking with your providers. and you can just make sure that you know that your voice is important.
I love it. So a huge thank you to all of you. A big shout out to our other Lupus Foundation of America staff that are behind the scenes working this evening. And a big thank you to all of you that tuned in this evening. Just thank you, thank you, thank you to everyone. We truly appreciate all of you taking the time to tune in. I know we're trying to get the slides back up as we wrap up here, but this is our contact information. Feel free to, of course, visit our website, take a look at our resources, especially the things we mentioned this evening. If we weren't able to answer your questions this tonight, feel free to reach out to our health educators. And we can go to the next slide. I think we might be a little out of order since we combined. There we go. So again, a big thank you. Also be on the lookout for our next Lupus and You event, which is going to happen in March. It'll be focused on protecting the kidneys and lupus nephritis. And then we can go to the final slide. I know that the link was dropped in the chat about our survey, but of course, everybody's feedback is so important to us. Like I shared earlier, it really helps shape these programs. So like I said, on Friday, you should get an email with the recording. We'll also put the link to the survey in there if you don't use the QR code or the link in the chat today. And if you fill the survey out and provide your name and contact information, we're going to select two people randomly that complete the survey for an LFA swag bag. And we'll close the survey in 2 weeks. But again, a huge thank you to all of our speakers. I wish we had more time. Thank you again and have a great evening and a great start to 2026.